Hi everyone, welcome back to another video, and today we're going to be talking about medical ethics because the governor of Ohio passed a healthcare provision allowing for providers, hospitals, insurance companies, etc. to refuse healthcare treatment to people on the grounds of morals and ethics that they hold personally. And this is a problem. I think this is a violation of medical ethics, so we're going to talk about that today. So what exactly is this provision that they passed in Ohio? So under this provision, it talks about medical conscience, and it is where healthcare workers, hospitals, and health insurance companies are allowed to refuse to provide, perform, or pay for specific medical procedures or services that violate their conscience as informed by the moral, ethical, or religious beliefs or principles held by the practitioner, institution, or payer. So essentially, this is saying that the provider, the hospital, the health insurance, the support staff, anybody involved in this medical treatment can just say, well, I don't like this morally, so I don't need to provide you this service. And this is a problem for a lot of reasons, but we're going to go into exactly why. So there are some reasons why a doctor might deny services to a patient. And we're not talking about these legitimate reasons for somebody to be denied a service in healthcare. There are a few reasons why this might happen. So the first one, which makes a lot of sense, is medical contraindication. So this is when a medical treatment is not indicated because you have some medical reason why it would be unsafe to do so. For example, a patient with a history of breast cancer might want to stay away from estrogen-only birth control because estrogen has been shown to worsen breast cancer and increase your risk. So this is a medical contraindication. This person might be denied a certain medication or service because it's unsafe to give it to them. And that is a legitimate reason to deny a service. Secondly, a patient who is unwilling to follow certain procedures. So this might happen when, let's say, you're about to undergo a surgery, and for most surgeries, if you're going to be intubated, you need to be NPO, or meaning you can't have any food or drink by mouth, because that puts you at risk for aspirating, and it can be very dangerous. So a surgery might require you to be NPO before the surgery, leading up to it, so that you don't have this extra risk. So a patient who refuses to comply with those procedures might be denied a surgery because it's no longer safe. So if a patient decides, well, I actually want to eat before the surgery, they might be denied the surgery because they're not following procedures that are meant to keep them safe. Also, lastly, if the doctor believes that they are not qualified to handle your specific case, that is an appropriate time to deny services. But also in that, if a doctor is going to deny you that service because they are not qualified to handle that, they should be responsible to give you a referral to somebody who can handle that. So let's take an example of a pregnancy. So somebody goes to their family medicine provider for managing a pregnancy, and the doctor decides that this pregnancy is now a higher risk pregnancy, and they're not comfortable. They don't think they have the necessary ability to manage this case safely. They might refer to an OBGYN specialist who can handle more complicated pregnancies. So that might be a case where you might be denied a service by a particular doctor, but in turn that doctor should be able to provide you with the name of somebody who can provide you that service. So when we're talking about this specific healthcare provision, we are not saying that these reasons are unethical to deny care. These reasons I just mentioned are appropriate reasons to deny someone healthcare. But what this provision is doing is it is saying that you can deny treatment based on your own subjective morality, whatever you deem to be okay. So if you have a transgender patient who is asking for HRT or they're asking for gender confirming surgery, it's not saying that you can't deny them the surgery based on a medical reason. It's saying that you can now deny them based on the fact that you disagree with them being trans, or you disagree with this procedure for some ethical reason. And I do not think that this is appropriate, and I don't think it follows medical ethics. So one of our pillars, one of our four main pillars of medical ethics is justice. And this concept of justice just means that patients are treated impartially without bias on account of gender, race, sexuality, etc., etc. So basically, you can't determine where treatments go or what kind of treatments are given to people based on these statuses. So, like, if somebody is poor, they don't have a lot of money, they have low socioeconomic status, you can't say, well, I'm going to deny you this emergency service because you're poor. That would be a bad example of justice, because you are denying someone treatment that would save their life based on some factor that they really can't control. But this also goes into this healthcare provision, because treatment that has been shown to be the most up-to-date standards of care for trans people and for others in the LGBT community, being denied these treatments that are the standards of care, that goes against justice. It is saying that because of this reason, because of your gender, your status as a trans person, your sexuality, etc., that you cannot receive this treatment. So, some problems with this specific provision, and explaining more into why this goes against justice. As a provider, as a healthcare provider, you are a servant of the public, and especially if you're a physician, you have to specialize. You have to choose an area of medicine that you are going into, and in your board certification, you have, your responsibility to provide services that meet those standards of care in your particular specialty. So you choose a specialty based on your interest, based on your board scores, all of that. You go into a specialty knowing what kind of procedures you are going to be giving people, what kind of care you are going to be giving. So if you cannot meet those standards of care for whatever ethical reason, if you have a religious reason why you can't be giving somebody HRT, you should not be going into a specialty where you would be prescribing HRT. That's ridiculous. That's going into a specialty knowing that you cannot provide the quality standards of care that is expected of you in that field. So that is absolutely a problem. And along with that, if a certain doctor does not want to perform these procedures or interventions, that does not guarantee that another doctor is going to be available to provide those, especially in rural areas or areas where there just aren't enough physicians. There's no guarantee that that care is going to be available somewhere else. And something that this governor is covering his butt with in this is that, oh, well, people can just go find another doctor that'll provide them this service. Well, you don't always have that option. So why are people in a certain specialty that they chose allowed to deny care to people that is the most up-to-date standards of care that they should be giving to everybody with that certain medical condition? Also, this bill isn't just about doctors and healthcare providers. This is about insurance. This is about hospitals, and then also any of the support staff. So nurses, techs, and assistants, people setting up procedure rooms, people assisting in procedures, can also refuse on these bases of ethical concern for them. So again, these staff members choose to work for certain providers. So if you're choosing to work for, let's say, a hormone clinic or an endocrinologist that you know is going to be providing trans people with HRT, and then you're going in to sabotage and just say, well, this is against my beliefs, I don't want to set up the room, or I don't want to get these medications out for you to use, that's really going against your job. You should not be in that job for that physician or PA, NP that you are helping to provide services for their patients. If you want to be an assistant, like a medical assistant, you want to be a nurse for a certain specialty, but you don't want to provide the care, that could be a problem. Maybe instead of working for an endocrinologist, in that case, if you don't want to prescribe HRT, you should be working for an ophthalmologist who is not going to be asked to do those kinds of procedures. So, like, for example, I disagree pretty wholeheartedly with routine infant circumcision, right? It's something that I would not wish to do. And so I'm not going to go into a specialty that requires me to do that. I'm not going to be working for a doctor that's going to require me to do that. That would just not make sense. So instead of going into the specialty and then refusing to give people care, I should just not work in that specialty. It is not the patient's job to find every provider and have to go doctor shop for someone that's going to give them the care that they need. It's the doctor's job to be able to provide the service that they have been trained to provide. So I kind of ranted a little bit on that topic, but this all comes down to one simple thing. If you cannot provide the specialty of care that you practice to everyone, don't work in it. And again, this is not saying that you should give treatment for any of the medical reasons I mentioned above, medical contraindications, patient unwillingness to comply to procedures, and doctors not being qualified to provide those care. That's not what I'm talking about. Again, this is only about using your ethical judgment, your moral judgment to make decisions on a patient's behalf. If you cannot meet your standards of care for your specialty, for everybody, and if you cannot uphold the medical ethic of justice, then you should not be working in healthcare. You should not be working in your specialty. And that's where I'm going to leave it. I'll see you all in the next one.